I'd like to call this March 18th, 2025 regular meeting of the Board of Public Safety to order. And first on the agenda is the approval of consent agenda. Consent agenda for this evening contains the following items. Approval of minutes from the February 18th, 2025 regular session. Approval of claims for the periods of February 28th, 2025 to March 14th of 2025. Approval of payroll for the periods of February 21st, 2025 and March 7th, 2025, and certification of the executive session. Does any member of the board wish to have any one or more of these items removed from the consent agenda to be discussed separately? No? No? Okay. And hearing none, does any member of the board have any objections to any of the items on the consent agenda? Okay. Hearing none, the items on the consent agenda are approved. And now we go to the police.
Is it on?
And
No, that would help.
Hey, look at that.
There's our calls for service for the month. We've had, again, as we've typically seen, a little increase from the same period in 2024. In 2025, with us having 13,000 calls for service through February. Comparison of our stats over the past 3 years, seeing the typical ebb and flow that we see through those years. Nothing statistically really standing out for us right now. Traffic stops year to date, we're actually down a little bit this month. A lot of that's probably weather related with the significant weather that we had in January and February. Obviously our folks weren't making a lot of traffic stops. Crimes involving weapons, year to date, so far there have been 53 incidents where a weapon was reportedly involved. A firearm has been reported in 36 incidents, and firearms were fired at people 4 times in 2025. There's our adult arrest for February. We are down a little bit. Again, a lot of that probably is weather related, and just not a lot of people out, not a lot of things happening. So. Our juvenile referrals were up in February just slightly. We got some calls at schools and things like that, and supported the school police for some calls in February. This is not a hate crimes reporting period. That'll be the next meeting. We'll have our official stats, but we were 0 so far. Nuisance calls, again, disturbances continue to be the bulk of our nuisance calls at 67%. Intoxication and vandalism follow that up. Some highlights for our activities this past month. We had 759 training hours. 15 of our officers attended BPD 3-day annual in-service training. 7 officers completed 2 hours of emotional survival for law enforcement, which is a new state mandate. 3 of our officers attended our multi-day crisis intervention team training. 2 officers attended the 3-day Indiana Drug Enforcement Association conference. And 1 of our officers did a 2-hour course on communication skills for effective leaders. And 6 of our officers attended drone training. Our community engagement for the month, we had 12 events, 14 hours, and we had 20 officers involved. Several of our officers attended a surprise birthday party for an 18-year-old member of the community that idolizes first responders. Our CSS folks had a lot of outreach this past month, and we did a safety meeting with Bloomington Board of Realtors. We continue our monthly efforts with partnering with Monroe County Humane Society or Association and our Forever Friends, advertising pets that are available for adoption. And we had a presence at the Benford and Rogers Elementary School Carnival. Our social workers for the month had 72 referrals. They had 346 contacts. Some highlights here are MHPs organized and facilitated the CIT course, that annual 3-day course. We had folks from BPD, Sheriff's Office in Ellisville there. We connected a client with cremation and burial assistance, assisted a client with filing for a protective order, assisted a client with accessing an assisted living facility, and worked with a church to get local volunteers to help them. Our ORS staff assisted 6 people with ordering phones. ORS completed 3 house assessments as well, and they assisted community members with food stamps and health care. General business, you'll see some expenditures coming in for our usual replacement of cycle of equipment. There will also be some service contracts coming up on some software that you guys may see. Ryan will cover personnel for us.
Sure. Right now, we currently have 16 vacancies. We have 6 in our field training program. I'm sorry, to be 7 in 3 days. We have one that's coming out. How long was he out? A year and a half?
Over a year.
Over a year with a shoulder injury. So he will be coming back to full duty status, but he'll do an abbreviated FTO refresher just to get him, make sure he's back into the swing of things. We have one at the academy that graduates on April 25th. And then we have a couple that are out for extended light duty military deployments. One is awaiting a medical retirement currently that the board met on last Friday, I believe it was. And then we have 11 in our current hiring process. Right now they're bouncing between their psychological evaluations and their medical examinations. So I had to schedule all 11 of them. So hopefully get some stuff back on them and be able to move forward with actually offering them positions probably over the next 3 to 4 weeks, depending upon how long it takes for the medical paperwork to come back. Sometimes they're fairly quick. I actually got a couple back today that just went last week. Sometimes it's up to 2 weeks. So, but that would be the largest hiring class that I'm aware of us having.
Yeah, it's the largest in the 28 years I've been here.
So we'll see if they all are able to move forward. Sometimes, medical or psychological things come up, but that's the plan right now. I think that's all we have as far as personnel. I would like to touch on, yesterday you did talk about pursuits, and we have a weapons call, and I think it's important to note how well the officers did yesterday. We had an officer that got involved in a foot pursuit with a man from the area of Seminary Park. He was running through yards and backyards, and the officer was finally able to catch up to him. He was not compliant with the officers and actually was trying to access a handgun in his waistband. He did get control of the gun, and he did get it. He did actually produce the weapon, but the officer was able to control his arms enough to, before they finally got the weapon away from him. So, did a great job. He's a convicted felon. He's not supposed to have that gun. The gun's not serial numbers. He was wanted on warrant, so they showed some great restraint, but I think they did a fantastic job yesterday.
Good work. Fortunately, wasn't injured in the process.
Correct. Yep.
That's good.
I have a question, really late into this. How much, if any, are the federal changes affecting BPD as far as grants or training, any federal training, anything like that? Not so far?
To my knowledge, we've not been affected at all.
We've not been affected at all.
So following up on Barb's question, I was thinking this as well. It's not only going to be federal cuts, but state. And are you thinking, I don't know what to anticipate thinking out, but Medicaid looks like it's going to be pretty severely chopped. Indiana may either go out of the Medicaid system or cap at half 500,000, and they're currently 750,000 roughly on it. Just encouraged to think forward about
Sure.
that.
Yes.
And I don't know what's going to happen to Senate Bill 1 as it comes
Yeah,
out of the House.
and that's the other issue about
yes.
funding, yeah.
Certainly some tax cuts there and some implications of, reduced funding, so just have to see how it comes out.
Our mental health providers, our MHPs, are already sort of looking at things like we know that adult protective service is going away. It's going to go to a privatized practice. We know that potentially that's going to increase their caseloads, and sort of how we can start managing that and get forward on that. So it is definitely stuff we're looking at, but we don't know what we don't know until
Yeah,
it
exactly,
happens.
yeah.
So that's sort of where we sit with it. Certain deployments, we did have 2 ARV deployments last month. One was the call at the hotel out on Liberty Drive, which was originated as a county call with a barricaded gunman. The ARV was deployed on that and was used to give officers armored cover as they got him out of there, and they were able to successfully get him out and get his mother out, who was afraid to leave, and we had to get her out as well. So there was that, and then it was deployed on a group of subjects that were wanted for an armed robbery investigation on the south side of town, and they were again barricaded in the house and refused to come out, and it was used as a position of cover for the officers during those operations. Letters of appreciation. We got these. This is actually from Colonel Randy Jacobs from the Sheriff's Office. He wanted to express his gratitude in regards to that operation on Liberty Drive, where they asked for our support. The agencies worked extremely well together, and we worked really hard on that.
Another armed subject that we're able to,
Yeah.
they're able to get him out of the room without any rounds being fired, so.
Nick, I didn't hear anybody cover large expenditures.
Oh, sorry. Large expenditures, the only thing again, we'll have some procurements. You're gonna see stuff coming in for vehicles. There's finally a state bid for vehicles, so that purchasing process has started. And there's gonna be, I think we have some software contracts coming up related to not dispatching software, but it's kind of related to that. Search functions for the officers. Some of that contract is coming up that's being worked on right now, so you'll see those expenditures. And now it is our friends at Fire's turn.
All right. Okay. So we have our year-to-date operational incident type and where they are at. February runs, we had 500 calls, 4% more than we had a year ago, and 34% higher than what we had in 2020. 2020, we had 330 calls in February. 86% of our runs are in the city. Of those, 14% are on campus. So, and as you can see, like I said, February is gray. Year to date, 1075 for calls. Incident types on campus, false alarms are still our number one, and they probably will be for life. So. February calls, the red spots are where we go most frequently. So we have Wheeler Mission, Rockport Road, Crawford Apartments, the Biology Building, I believe, on campus, Woodbridge Apartments, and Willow Manor. So we're
Why
pretty.
the biology building?
A lot of times they're autoclaves. That between that and chemistry, the steam vents.
Okay, that makes sense.
So. Sometimes it's just the location of where those are when they move an autoclave, and then they don't consider it, and they open up and there's a rush of heat, and then so
Got it.
we have that. And here we have 56% of our runs meet the goal of arriving on time in under 4 minutes, and that is for the first engine. And with the yellow ones that don't meet that, those are, the battalion chief follows up with that to see what's the reasoning why you were delayed. Was it traffic or construction? For prevention and public engagement, prevention stats, we are 12% of our goal for inspections. These are commercial entities, so the goal is to get 2250 for the year, so that's where we're at. Bloomington has roughly 3,800 commercial locations, but 2250 is where we are shooting for. February was a better month than January for public engagement. For training education, the time this was posted, the Recruit Academy had already had their first live burn, so that is at the burn tower on 3230 South Walnut. They've had 2 more since then, so it gives them live fire experience. We're just burning straw and wood, nothing bad, so that's all that we're allowed by IDEM to burn. So
No old houses or?
no old houses. We will never purposefully burn a house down in Bloomington.
Sorry, I brought it up.
Thank you.
Another success.
Don't eat paint chips. That's all I'm gonna say. We don't have to tell.
Apparently there's a story behind that.
Oh, can we talk about it off camera? I'd be happily.
Absolutely.
Personnel, Hamel, Vandegrift, Mason, and Lebowski. They all did training out of town. We're doing some technical rescue, so they're doing some confined space, or they're doing advanced motor vehicle extrication. So when they're, for the most part, they're going up to advanced rescue solutions, and they train in Greenwood for that. And then we hosted a state certification class for Instructor 1. 4 different departments were represented, and I had a total of 21 students with that. So you can see that for our month, we are at 4320. Our year-to-date is 9749. So our goal for the year for training hours for the entire department is 42,000. So that roughly 30 to 35 per person. Excel and I were having issues, so that's why we have a bunch of zeros. My apologies. Sometimes Excel is amazing and other times it is not. So for February statistics, it was 10.4 average visits per patient. 39 services were provided, which involved 18 different agencies. Referring agencies, there were 5 of those and 14 referrals this month. So when I talk about the agencies that were utilized, several of the township trustees were used, the DROs from BPD, their social workers, Meals on Wheels, Ivy Tech Community College, services they facilitated involving APS and CPS, shelter, food, mental health referrals, disability service, medical, primary medical. The team started a Bloomington Safe at Home initiative, so while we already have smoke detectors, we have homes that they are visiting that don't have carbon monoxide detectors, and those are a little bit more pricey. So they were able to get 70 of them donated between Lowe's and Corson, so they're still working on that. Next up will be first aid kits for some people who don't have them at home. So, yeah. And let's see, data collection with the hospital for they're looking to make sure readmissions aren't happening. So they're looking at they're actually working with the hospital to collect data for that, and their first referrals have come from that program have come through, which is good.
Excuse me, can you
yes.
say more about that, the readmission issue?
The readmission, so a lot of times the hospital does not get reimbursed if a particular patient, let's say a Medicare patient, gets readmitted within 30 days. So sometimes the people get sent home, sent home sicker than you would have 10 years ago, and sometimes if they don't have the avenues for home health or insurance won't pay for it or family just can't manage to get them to their follow-up appointments, this is where we're stepping in and now we're actually taking care of some of that, doing tracking vitals for them,
Okay.
sending them to the doctors and stuff like that. So they're getting some follow-up medical observation, and so they're tracking these for, hey, does this program make an impact on readmission? Because normally this patient, let's say they've been readmitted previously within that window, and so the hospital didn't get reimbursement, but now they'll say, look, they involved MIH, and look, they did not get readmitted, until they had another serious, a stroke 6 months later or something.
Yeah,
Does
one
that
of
make
the
sense?
Hospital administrators was pointing, this seems unreal, but I think it was reported that some were readmitted as many as 50 times last year.
And like I said, you're going home sicker, but if you don't have the means or,
Exactly.
insurance can't or won't pay for what is actually needed, it makes it difficult.
Well, thank you for
Certainly. Our program manager co-presented at a MIH national conference in Tampa alongside the state MIH medical director, Dr. Yazel. So that went well. She is also speaking at another national MIH conference later, actually next week. I will be going. The team also co-responded with the social workers from BPD, followed up with a patient, and then they were able to get them prompt, proper medical care. An added win, because I ran out of space, they were able to work with Ivy Tech to keep 2 students that were patients in college, despite a tragedy that they had in their family. So they worked and were able to keep them in school.
Amazing.
Yeah, very, very cool. So I have that.
So regarding personnel issues, we are currently down 2 folks. We have a hiring process in the works now that we intend on filling those positions in 2 positions. Yeah.
We heard.
We heard.
So we hope to fill those this fall, likely with lateral transfers. At 2 positions, it makes it difficult to warrant a full academy. So a lot of times the candidates we get are on other departments, and they can simply lateral over with a minimal academy to get them onboarded. We also have 4 light duty personnel currently, 2 of which are slated to return soon. So it'll be nice to have them back. And,
Recruits.
and we have, in addition to that, we have 5 recruits that are going to be coming on shortly. 4 are on the 31st, 1 is on April 3rd. So even though we're down 2 folks, that is actually 5 more people that aren't on shift that will be soon. So that'll help tremendously as well. Other than that, personnel-wise, we have the 2 individuals that we'd like to promote to captain that we discussed earlier. Vic Volrath promoting from chauffeur to captain, and Matt Andrews promoting from chauffeur to captain. Both of them effective March 17th.
All right. And on that note, can I get a motion to promote Victor Volrath from fire chauffeur to fire captain effective March 17th, 2025?
So moved.
Second.
Okay, I have a motion and second, and is there any discussion? No discussion? All in favor? Aye. Any opposed? None. That motion passes. Okay, can I get a motion to promote Matt Andrews from fire chauffeur to fire captain effective March 17th, 2025?
So moved.
Second.
Okay, I have a motion and second. Is there any discussion? All in